97.9, where we make the hottest hip hop and R&B. I am your girl, Shani Sweets, rocking it out with you inside of the Pretty Girl Playbook. What's happening? Gotta make sure y'all can hear me out there. There you go. So look, I got something real special for you because most of the time, right now, we're still rocking and vibing to the mix, but I have a special guest in the building with me, and I gotta introduce her. I need you guys to listen up. How you doing, Dr. Elizabeth Johnson?
Hello. Thank you so much for having me here today. I'm so excited to be here with y'all.
Absolutely. So first and foremost, welcome to Hot 97.9. You guys, this is another doctor from Advanced Community Health. We're going to be talking about some things. We told you they're going to come in every month, maybe once, maybe twice a month, and give us the knowledge that we need. Let us know everything about how to become a patient at Advanced Community Health, get information that we need. And so we're going to talk to her a little bit about who she is and what it is that's important to her as the doctor in the field that she's in. So one, I just want to say thank you.
Of course.
And we're here to talk about immunizations.
Yes. A very, very important topic. Something I'm very passionate about because I am a pediatrician. So my first goal is to make sure that your children are healthy and safe.
Okay. So school is starting back. It's
Yeah.
the time to get all the vaccinations, go get your physicals, all the things like that. What are some common misconceptions about vaccinations, immunizations that you would like to address?
So one of the biggest misconceptions that I hear all the time is the false link between autism and vaccines. So that fear initially came from a now discredited study that was put out in 1998 by Dr. Wakefield. The study only involved 12 children, and if you know anything about statistics, that's not a good number at all, okay? And later in investigations, they showed a lot of serious misconduct. So that study was then, completely taken out, and the doctor actually lost his medical license.
Wow.
And since then, they've had to do like a ton of different studies just to show that there is no link between autism and vaccines. Unfortunately, even though there are tons of studies out there for people to see, that fear still, exists.
Yes.
So that's something that I commonly hear from parents.
Gotcha. Now, we were just talking about how many nieces and nephews that we have.
Yes.
Do you have any children yourself?
I do not. I
Me
have
neither,
fur
girl.
babies.
Me neither, girl. We outside, okay?
I am fine as Aunt Izzy. I am good.
Okay, we fine. The fine aunties, the rich aunties, we all our things.
Yes.
Pop up and send the kids home. We'll be ready to go
Yes.
outside.
Come get these kids.
Come get your kids.
Yes.
But in that, I'm pretty sure we both have heard different stories about how different siblings want to raise their kids.
Yeah,
what doctors
of
they want
course.
to take them to, all the things. So what is some advice about people that's hesitant in getting their kids the vaccines? Some parents are like, got the doctor's appointments already booked.
Right.
And some parents are looking for alternatives. So like when they're in that space of hesitation, like what would you say?
So first, I think you have to understand that parents at the end of the day just want to feel confident in making the best decisions for their children. That's what it comes down to. So I usually approach that conversation with empathy, patience, and respect. And I want to let the parents know that I'm here to partner with you. I'm not here to pressure you. Right. So that's the first step. And then I usually remind parents, if you're a little hesitant about vaccines and the schedule, that the schedule is not random. It's not made up. It's based off of decades of studies and research about safety and effectiveness, and that we can give those vaccines at the right time when children are the most vulnerable.
Right. And I think you just hit on what I'm about to say a little bit already, but when it comes to everything that's happening with the pandemic and with things being, as we say, man-made, or we don't really know what is coming from, especially if we're just the consumers and not in the field. So like, what are some of the most effective immunization strategies people can use to protect themselves and their community?
So something that I forgot to mention is, you want to make sure that you're established with a good PCP, with a good pediatrician, a good primary care doctor. That way you can build that rapport, you can build that trust, because I'd much rather you come in and ask me 10 to 15 different questions than stay at home and you're worried, right?
Yeah.
And you don't know. I want you to be well informed and not misinformed. But the best strategies that you can have is staying up to date with your visits, staying up to date with vaccines. So don't miss those appointments. And if you do, we have ways to catch you up.
What are those options available at Advanced Community Health if they have fallen behind on their vaccines?
Those options, you can come in, establish care, and then we get children usually on the nurse-only appointment schedule, get their vaccines up to date, and make sure that they're in for their well visits as well.
how can the listeners afford that? If they need to come in, if they're afraid that they might have to pay more for more vaccines, they missed all these things, but like, how can the listeners access affordable vaccination services and immunization resources?
So at Advanced Community Health, we make sure that we see the patient regardless of their, status. It doesn't matter if you have insurance or you don't have insurance. We make sure that we work with families and that they can get the care that they need. When it comes to children, because I'm going to speak to that since I'm a pediatrician, children are never, ever, ever charged for vaccines. Either the insurance company will cover it fully or the government does through Vaccine for Children program. So children are never being charged for vaccines, or the families of children are never being charged.
Gotcha. Now, I personally have a question.
Of course.
Now, the radio station just went out downtown where there's a lot of protesting going around about Medicaid and things like that.
Yes.
And then now we've officially seen what is being cut with Medicaid.
Yes.
How will that affect children or the families? Like, is it anything in, like, for a pediatrician to be kind of like aware of?
Yes, I mean, I think that this should just be a charge to people to pay attention, not just to your presidential election, but your general elections. Pay attention to who you are voting for on your school board, your city council, Congress, different things like that. They are making the decisions that are affecting your children, affecting your families. And something that I'm really big on is providing evidence-based medicine, right? And so when it comes to vaccines, immunizations, one of the programs that provides that background is the ACIP. Something that people should know is that our Health and Human Services Secretary, actually got rid of them.
Wow.
So I just want people to pay attention to what's going on in your everyday life. Call your representative. Say that you want evidence-based medicine, evidence-based programs, okay?
Right.
And if you're not sure of how to go about things, come see your doctor. See how you can be an advocate for yourselves and be active in your community.
Absolutely, absolutely. Okay, so right now you're a healthcare provider and you are helping everybody, even with coming up here and talking to us. So what is something that you can help with your patients feeling more supported when dealing with this, when they have these immunization related concerns?
So again, I'm just a big listener. I want people to come in and I want you to feel like I'm an extension of your family, right? So I'm going to talk to you the same way that I would my nieces, my nephews, my siblings. I want you to feel comfortable enough to come to me with all of your questions. So that's what I do as a physician. I take that as a very serious charge that I'm an extension of your family.
Gotcha.
So come to me, talk to me, bring me all your questions and concerns.
Now, I know you can't give all the cousins your phone number.
I can't.
You can't give the cousins your phone number, like she said, if she's family. But where can people learn more about Advanced Community Health Services, and how about booking an appointment?
So you can either find us online at Advanced, that's ADVANCECHC.org, or call us at 919-833-3111.
Thank you. Look, you guys, you're so welcome. I'm so happy that you're here. Dr. Elizabeth Johnson, you guys, at Advanced Community Health. Make sure you keep, I'm trying to tell you guys, stay inside the Pretty Girl Playbook and Hot 97.9, because we're always trying to drop information, knowledge, resources for you guys to go and get exactly what you need to stay fit, healthy, and, have your mind right, okay? So make sure you reach out. Once again, for more information, visit advancedchc.org. That's advancedchc.org, or call 919-833-3111. Okay, advanced providers are here to support you in all your healthcare needs. Once again, thank you.
Thank you so much. I had such a good time.
All you ladies out there that's having these babies this summer, I'm sorry, but we still got you.
Yeah,
okay?
come by me. Come by me.
You go see Elizabeth. You can't come outside with sweets, but you go see Elizabeth, and she's gonna make sure you and your baby are healthy, strong, and get everything that you need.